Hi again, everybody. This is Dr. Kusuma from Surya Plastic Surgery and from Symplast. I'm the founder, former CEO of the company. I wanted to resume the wonderful story that we started last time. You guys heard part one of the story. My good buddy, Dr. Miles Graivier in Atlanta, of course, was sharing his amazing transformative journey of his health, really on the patient side. And we got through the first part of it where he developed cancer, he got treatment, and then towards the end of that session, he had to get back because something was not right when he was in Europe. And that's kind of where we're going to take off again and kind of start the story back again, because part two promises to be even more uh, amazing than part one. So, without saying much more, Dr. Graivier, please share your story where you boarded the flight in France, I believe, and are headed to soon call your own code.
Yes, thank you, Shashi. I appreciate again the opportunity and with Symplast certainly to work in conjunction with you guys and again very excited to number one share my story, but also look towards the future of how we can help our post-operative patients as well as help our patients that have issues such as this with cancer in my case, but other medical issues that we can kind of give the benefit of our now, unfortunately, my personal experience. So as you were saying, my journey kind of continued after I was diagnosed with the metastatic disease in my mediastinum in my chest area, and I was given basically prognosis, and not a good prognosis of about a 20 to 30% responders, and so about a 2 to 5 year survival essentially. But I started on the dual immunotherapy trial, and after the first one, I did very well. And 3 weeks later, I went to the day after my treatment, I went to Europe to drop my daughter off and then go to my goddaughter's wedding in England. And I flew back from first England, then France to Bordeaux, and then got on the airplane myself from Bordeaux to Paris, and then Paris back to Houston, MD Anderson. During that time period, unbeknownst to me, I was feeling quite bad, quite naked, as I think we'd already talked about, where it turns out my pulse was about 20 and I was in complete heart block, but I did not realize at the time because I felt, that very, very foggy, but I continued to walk through the airports and got in the taxi when I got to Houston because I was going for my blood test. And by the time I arrived at MD Anderson, I asked them to roll me over into the emergency room area, and they couldn't get a blood pressure. So they rolled me back, and at that time, it's just the EKG tech. And when she took my EKG, I read it myself and said, oh, God, I'm a complete third-degree heart block with a ventricular response rate of 20. So I said, you guys have I need a pacemaker right this minute. And they pressed the green button or the red button, however you want to call it, rushed me upstairs into a code situation.
I'm still trying to understand how you are like lucid enough to engage like this, but anyway, those are mysteries of life we will never understand.
It truly is. I probably should have come in flat on my back with a tag on my toe, but luckily I didn't. I made it to hour 73 as they're getting the cath lab. And another, probably an act of God too, is that the cath people were getting ready to leave at 4 o'clock, and I arrived in Houston in the emergency room at MD Anderson at 3:30 p.m. So otherwise, I would have been transported to another hospital. But as I said, they started some IVs. They weren't getting any blood flow through 8 angiocaths, and that's when I woke essentially to a compression on my chest.
So just to paint a picture, this is what you see in movies or TV shows sometimes. There's the beep on the monitor, suddenly it just goes like a straight line, and suddenly, people start doing something, right?
Yes, exactly.
Yeah.
And so quite interesting that I obviously woke up with a chest compression, and they got me back to the cath lab, and I asked if they were going to give me any IV sedation, and the electrophysiologic cardiologist said, no, we would kill you. The little did I know that I'd been dead before right before that happened. But I said, go ahead and put this in. And they put it into my neck through my IJ, internal jugular vein, which I said, go ahead and do it. And he goes, your neck is really stiff, the skin on the tissue. I said, well, it's radiated skin. I expect that. But the good news is after some struggle, we got the pacemaker in, they turned it on, and life was good. All of a sudden, I was getting blood flow again, and I was hungry, and I called my friends when I was going to the ICU, and I said, I haven't eaten anything and drunk anything for 72 hours. You guys bring me a hamburger and a milkshake because I'm just starving.
Well, you got to tell us, what's the favorite place? Where did you get the milkshake from? Where did you get the burger from?
Yeah, in Houston, actually, there's a place called Beck's Prime, and right fairly near the hospital, and they came up right in the ICU with my hamburger and my very greasy French fries and the shake, and they were the best tasting hamburger, French fries, and shake that I've ever had. I will swear that to the day that I do die again anyway.
So they didn't keep you quote unquote NPO for this. They just kind of, you were back to, normal activity, as we say, resume normal activity.
It was interesting because they took me to the intensive care unit, and I was there for one day, and they said, we've never had your troponins. We never seen troponins as high as yours were. We never had anyone walk in the MD Anderson Mercer as sick as you were. And my troponins, which normally should be less than 10, which is the enzyme that's secreted by your heart if there's damage, were in the 7,000 range. And so they said, we need to do a cardiac cath tomorrow. So we're going to do that just to see how damaged your heart is, because it was related to the immunotherapy that I was getting. It was a cardiomyocytis secondary to that. And the cardiologist knew that, but they said, we'll do a cardiac cath tomorrow and we'll see. And they did. The next morning we did a cardiac cath. This time they did give me a little bit of sedation, which was nice. But afterwards, the cardiologist came walking in, he was shaking his head. He says, I don't understand anything about you or why this is happening. He says, look, your ejection fraction of your heart, meaning the heart was pumping the next day at 60%, or ejection fraction 60. He said, your vessels were completely normal. But I biopsied your heart, and we have a scale 1A, 1B, and 2. He said, normally we've never seen, we don't have a number for you. If we have a number, it would be a 10. He said, we've never seen inflammation in anyone's heart to come anywhere near how inflamed your heart was from this immunotherapy. He said, but I also understand is that you're only using your pacemaker. It's a demand pacemaker. It's only being used less than 1% of the time. There's no reason your heart should be pumping like this, and making its own pulses again. And the other cardiologist that put the pacemaker in came on a little while afterwards, and it says, we may need to make this a permanent pacemaker. And I kind of snickered, I laughed, and said, no, I'll be walking 4 miles outside the hospital tomorrow. Said because they put me on the floor that the very next day, and sure enough, after my cath the next day, I did walk 4 miles outside of the hospital. But it was kind of funny because people would stop me in the hall and even outside, and they go, "Weren't you just in the emergency room like asystolic yesterday?" I said, "Yeah, that was me." So they really had no way. But the interesting part of that, of course, is that a week later, my oncologist and I had decided to order a PET scan, which is a radiologic scan that shows tumor activity. I said, well, let's go ahead and order it to see if at least all through this that my tumor has at least shrunk 20 to 30%, meaning I'm a responder, that, at least this would not be for nothing. And so she did, and it was in the afternoon, exactly 7 days after, I'd had this event, and I was walking my 4 or 5 miles outside. It was 10 minutes till 5 o'clock. And I texted my oncologist and asked her if she had read my PET scan. And she responded that she had been ill that day and she had not been in clinic. But I said, well, that's fine. Come by tomorrow morning and we'll look at it together. And not more than 10 seconds later, she emailed me or texted me and said, OMG, oh my God, I've never seen anything like this. It looks like you've had a complete metabolic response of your tumor. We're not seeing any signs on the PET scan of remaining tumor in all these areas of your chest. And I said, well, I said, are you saying what I think you're saying? And she said, yes. I said, well, tell your PA to stay where he is, because if you've ever seen a person with a pacemaker in their neck in about 95-degree heat, running through the campus university at Texas Medical Center, right near MD Anderson. I was running as fast as I could to go up, and I pounded on the door, and I asked her PA to let me in, and I asked to see the PET scan. And he said, "Well, I can't, Dr. Graivier. You're on the study." I said, "I said, I'll never be allowed to have immunotherapy again, so I need to do it." He goes, You're right. So we sit down together and we start looking at each level, and he's looking at me and I'm looking at him, and we get the final level. There's no signs of any tumor left. And he starts crying, and I start crying, of course, and my sister was with me at the time, and she starts crying, and I just had to really take a moment and take that all in and really enjoy the moment. Of course, talk to my wife and my friends, and it was quite a moment, certainly unexpected, but it was really my second miracle of the whole thing. Quite amazing with that. So,
well, when you technically died, the cancer died too, I guess.
Yes. So that's a good way to describe it. Essentially, the cardiologist a week later, so I was in the hospital for about 2 weeks, and they were going to go ahead and take the pacemaker out. And I was running a little bradycardic that day. I was running about 45, 50, and one of the cardiologists was a little bit on the fence. And he kept calling one of the younger guys, and finally the guy says, "Take the bloody thing out. This guy's the Terminator. You can't kill him. Just take it out." So they did. And
I'll be back.
I'll be back. And so I was leaving the next day. It was very, very funny is that my study coordinator came in with another study coordinator, and who I'd never met before. And this other study coordinator came over. She touches my shoulder. She goes, "So, Dr. G," she introduced herself and says, "I haven't met you, but I really had to see if you were real, because we have a name for you here at MD Anderson that you'll always be known as." And I said, "What, the cockroach or the Terminator, like you said?" She says, No, at MD Anderson, you'll forever be known as Dr. G, the man, the myth, and the legend." And so I started, of course, laughing, and it was kind of funny. I said, "Well, I've written hundreds of scientific papers, but never had papers written about me." And they said, "Well, you're already in the teens. That they're busy reporting it left and right." When they did take my pacemaker out and went back and saw there were about 20 cardiologists waiting for me when I went back from my follow-up visit, and they all kind of conferenced, and I know them all now, of course, and they go, we really have to figure out a way to bring people down to the brink of death to get these agents to work, to really go even further. It says, "The problem is we're just not sure anybody else on God's green earth could tolerate what you tolerated, because we still have no explanation for how you did that." As a funny aside, when I had my follow-up last week for the 6-month scan, my wife asked my oncologist, said, "So, do you have any idea what the future holds?" And she said, "Well, not really. Obviously, you have no disease that we can find right now." She says, "We don't really know, other than, hopefully you'll never come back. But there aren't very many people that we really don't know, because we really don't have anyone else that's had complete resolution of their disease from this kind of recurrence that you had in your metastatic disease." So I think, it's certainly led me to be grateful for every day, try to live my life and show my gratitude and to my loved ones and friends, and just be thankful for that I have more things to do to try and share not just my story, but things that we can do in the future to help our friends and family. And I consider our clients and as our family too.
Before we get there,
Yes.
tell us what the 11 seconds were about. What did you know? What did you remember? How real was it?
It was definitely a glimpse into the other side. Time had no meaning, and it was quite fascinating in that I felt like I was in another reality in some ways, and that I saw a lot of clouds floating in just no apparent order, but each one under their own volition would kind of come in and focus very clearly where I saw distinct pictures in my head. They were moving more in clouds, but when they focused, I could focus on each one individual. I knew what people were wearing in each of these, and what we were doing, exactly the moment of my life that this occurred, and that they were very random. But I felt like I could focus for as long as I wanted to, and then that image would move out. They were all good images. It was very peaceful. I felt like time had no meaning. I could focus as long as I wanted at each of these images, and they were all good and wonderful images, and there was no rhyme or reason to the timing, and even the funny things that I would remember being at the Jazz Fest with a bunch of friends when I was in New Orleans, and the birth of my children, of course, and wedding, the usual things that we think of, parents, grandparents, but also just events in your life. And really, it just came down to the people whose lives that I've touched have touched mine. I think I got to see it all. And even in that 11 seconds, it really, the time factor of it was just non-existent. But I think it's comforting. It certainly has changed. Certainly, I don't have any fear of what happens afterwards, after we're not breathing air, living in the current state. But I think there's definitely something out there. And what's actually kind of fascinating is the day I was discharged, they came out with a study from Langone, NYU, where they were monitoring brain waves of people that had been asystolic, and they found that in that time period that brain waves did occur, and about 80% of the people in that study actually mirrored what my experience was, where they saw images, and it was not a bad or a frightening experience for anyone. I think it was a good experience in the majority of cases. So it was kind of, the timing was also quite interesting when that was published the day that I was discharged.
Do you think that everybody has common experiences? Is that what the study said, basically?
I think there were a few variations, but at least 80% of the people in the study, not a big number, but at least 80% had some recollection similar to mine of images in one
8
way
or
or
80?
another. As it went 80.
80. Okay. I mean, the story that a lot of people also talk about, and you see in movies and such, is there's a white light in the distance. You're walking towards that. This was different. This was obviously much more about your life and who you engaged with. It was a lot of memories, basically, resurgence of memories that you accumulated over the years.
100%. That I did not, see that the light. Maybe if I had been gone longer, maybe I would have. I don't know. But I do find it quite comforting to know that if you have done something to touch people's lives, to make their lives a little bit better, done something maybe make the world a little bit of a better place, then it's all going to be okay in the end.
So what has changed in your own outlook, Miles? I mean, are you now kind of behaving or living as if there is no tomorrow and doing everything and anything that you want? Are you being more cautious in your approach to, these are silly questions, of course, people think about, at your age, my age, which is,
right.
Are you saving for a rainy day? Are you putting money in mutual funds, or are you trying to buy a second home, or are you just living on experiences and living day to day? What has changed about the way you're living?
I think I've become the culture of go as opposed to the culture of no. I'm not turning anything down. I'm living every day the fullest, as much as I can, trying to get stronger, just happy with whatever progress I am, and I'm able to work a couple of days a week, not certainly a level that we are, but I really just, even just getting up and just even speaking with you, getting to reconnect and doing this, just it's saying things that make me happy. So it's not, I think carpe diem, seize the moment, seize the time, and maybe some things that we get a little tunnel vision on in the past. The time is now to not have any regrets, to go in the other thing.
What about your children? What about your wife? How has that relationship changed or not changed?
You know what? They went through a lot. They all did, and my hardest part is expressing my gratitude and how I feel about them, and you and all my other friends and people that have given me the support. Because no one's alone. No one could do this on an island, and I couldn't have done it without the support that I had from my family and my friends, and that kept me going one step in front of the other. I knew I had much more to do. I wanted to see my daughter and son get married and have children, have grandchildren. There's a lot of things, anything that I can think of, as I said, on my bucket list, I'm doing, and I'm taking each day where I'm trying to be, I think a little more observant, a little bit more in tune with people and with my world. I think I've been accused. You and I both know that we will sacrifice everything we can for our patients, our clients, our friends. But I'm really trying to do that and express my gratitude at the same time. So
How has this impacted your patient interaction lately? I mean, are you different as a surgeon, as a physician? Are you different? And if so, how?
I think I am, because I think I have a level of empathy that I did not have before. And I can actually speak from an area of knowledge and knowing what they're going through now, because just like you and I and other surgeons or other physicians here, I had very little understanding of our patients that would have, for instance, breast cancer or something. And we would send them off, and 6 months later, they would return after their chemotherapy or radiation therapy. Just having that knowledge and empathy of the things they've had to go through to get back to where they are, and then help them even further. Just the understanding of that has really changed my perspective. And not that I wasn't empathetic before, and not that I didn't care before, because I did and cared deeply. And I carry those people with me that do not do well, and that we've lost to disease processes in the past. But I feel like I can truly have a better understanding now of that. Because when I started this whole thing, I thought, oh, okay, I'll get my chemotherapy, my immunotherapy, and I'll get my radiation therapy, and I'll be back at work in 3 weeks, won't I? And they're like, no, that's not going to happen. That's not how this works.
Yeah, so you didn't have really surgery where you had a radical resection and reconstruction of anything truly. You went through this with radiation, with chemotherapy and immunotherapy, and one recurrence, obviously,
Yes.
or a brief remission of sorts, in a sense, and you gone to
Yes,
death and come back.
The only thing I had was I had the staging, both the tonsillectomy and the uvullectomy, and biopsies all over my oral pharynx, which showed the origin being the right tonsil and some skip areas in the base of my tongue.
Right.
Again, that was the time, I think we even covered this, that I really tested myself, because I knew I had an idea of what my ordeal might be, where basically I took one pain pill a day of surgery, and then proceeded to the week afterwards gain 10 pounds, just because I just sat there and would eat. If it took me 3-4 hours, that was okay. But really didn't take any more pain medicine during that time period, really, as more of a test.
Yeah, but what's remarkable is that, I mean, looking at you, listening to you, you sound normal. Your voice has not changed a whole lot. You don't look different. You have, some light in your eyes. You have some flush in your cheeks. You look healthy. You look like you are, for all intents and purposes, quite a healthy, normal person.
Well, I appreciate it. I am doing my exercises. As you can see, I have some tightness here, and having to get a little Botox in my sternocleidomastoid muscle, certainly, because it gets a little tight. But my swallowing exercises, a little bit of a neuropathy that I'm working through, from some of the chemo.
So one thing, Miles, just to go on the philosophical side just a bit, because I often think about this, the story a lot of times is similar. Whenever somebody goes through a crisis, a real crisis, when people really change. In your case, of course, you were like this, full of life, and cared about your patients and your family, you were somewhat similar, maybe more so in the direction now than you were before, but you were not like a radical departure of a personality from before, what sounds like.
Yeah.
But overwhelming majority of the people, at least the patients, that we take care of, because we have some credibility to talk about patients and some philosophy because people go through this. But it's almost often when there's a crisis is when people truly change and realize the importance of various things, my family, my health, my this or that. How can that change? How could that be a proactive exercise where you're always like that? Is it possible, you think?
Well, I think so. I think that if I had to do it over again over the years, that maybe my priorities would have been slightly rearranged. As you know, very busy practice. I used to operate 12 to 14 hours a day, 3 times a week, and 6 hours on other days. And in retrospect, I probably should have said, I can be just fine operating 8 hours a day, 3 days a week, and being home earlier during the weekdays and weekends. I was always doing my best to be completely unengaged with that. But I think certainly we get a little too focused on our careers and a little tunnel vision regarding that, and it maybe not tell our loved ones and our friends how much we truly love them and think of them and show it. As talk is cheap. We really have to show how we really feel, and it's I think that's probably been my biggest thing. The thing that took for granted before, that people won't understand. But I think that we need to tell them and reorganize a little bit of our priorities. Maybe this next generation has that a little bit better than us. Figure that part out a little bit. I don't know.
Yeah, you always hope, the next every generation subsequent should be better than the generation before. That's really the hope. That's what we try for our kids and grandkids and stuff like that. So hopefully, but so Miles, this is a remarkable story, just to put it together all, in a summary, a thriving surgeon, gets cancer, gets treated, some degree of remission, recurrence, almost dies, comes back, and now back at work and living life to the fullest again. It's a full 360-degree cycle kind of thing, and quite remarkable that you remember all of this and that you're talking to us right now in such a condition, and not just that. This conversation really is about what can we pass forward, right? Give
Absolutely.
forward to the next next phase of our lives in patient care. So let's kind of transition into that if you're okay with that, and I would love to hear, because there's a lot here that we talked about, from a giving it forward kind of thing, pass it on forward kind of thing. You talked about the importance of mental health, spirituality, gaining control of your own healthcare, so to speak, not take
Yes.
experts' feedback at face value just because they're an expert, and COVID certainly taught us that. Question it, try to do your own homework and research, and be empowered to feel that you own your own health and own your own life. So there's a lot that we covered there. And on top of that, you were very engaged with your physician friends and with your caregivers and your other friends for emotional support. And so you are incredibly active through the process. And you also showed through your behavior that it's not all about medicine. It's about, you participating and taking control of your health in terms of activities, diet and calorie control of how much you need to eat, and physical exercise to maintain your, physicality, so to speak. And so all of that I think pass forward. And now wrap that all, we also discussed in giving patients some tools that they can use perhaps in some way that is aided by technology perhaps, or networking of some type, that I think will probably take, this whole patient journey, patient experience, physician-patient relationship, outcomes to a whole different level. So I know you've thought about this a lot. I know you're
Right.
working on something already in this
Yeah.
arena. So why don't you share your thoughts around all of this?
Absolutely. Well, thank you, Josh. And you summarized incredibly well, and really succinctly my journey, and now where I'm trying to take this further. And as I said, Detroit comes close to home because we all have friends and family that are afflicted with these terrible physical issues, whether it's cancer or heart disease or a variety of other things that we see. And I really am making it one of my missions to try to use some of my knowledge and to empower the patients to find the right treatments and then not take things at face value, as you said. Searching the NIH web database for studies that are for types of cancers in different locations that can be used. Because as I had discussed frequently with my oncologist, that if I had not responded to the regimen and the immunotherapy the way I did, then we would be on to the next treatment and the next treatment and the next treatment. And we already were winding up plans, as well as even looking worldwide where they have experience in things that we don't even offer yet in the United States, such as these antigen-specific tumor vaccines that have been done in Germany for more than 15 years with some success. So, the internet is a great facilitator for that, and Symplast, certainly we have the tools that can help us with that. And there are things out there, as I said, in various phase trials, even in the United States, that are available, and just take a little bit of research and a lot of stamina and not giving up. Because again, a lot of the studies, while they're sponsored by the drug companies, they're looking at the efficacy of the drug. We are looking for the magic bullets, and magic bullets usually occur when you layer things on and you add them all up to a really good result. And that's what we're really looking for. So I think technology wise, that's great. Other parts, of course, is to have someone such as myself or other people that have experienced some of this to, quite frankly, see where people are doing it, be a little bit of their coach, offer them the opportunity for ancillary Eastern medicine, if you will, because I think that is very important. Meditation, yoga, basically techniques that will allow us to get through things without just taking drugs that are offered. That the power of the mind, we've barely unlocked that. And I think that is something that the mind body meld that I think is more Eastern than Western, but was, I think, incredibly important.
I mean, it's an important point to highlight here. I think you and I spoke about it, but I was born and raised in India, and that cultural aspects that include spirituality, include like you said, the various aspects that constitute yoga, which includes pranayama, breathing, which includes asanas, which is the physical postures, which includes the meditation, which is the mind sciences, which includes nutrition and Ayurvedic kind of methodologies. Of course, if you go on further east, the acupuncture and things like that, those are natural, and they were not even alternative in a sense. I don't even like using that word. They're actually integral. They are even more integral than pharmacy, really, pharmaceutical kind of drugs. And so that is something that, we as allopathic Western trained physicians and surgeons, I think, need to more readily adopt and accept and propagate through our mantle or through our credibility as surgeons and physicians, right?
And I've seen it work. And that's, they actually did a yoga study with my first round of treatment. And because I did so well, they now offer yoga for all forms of people with cancer at MD Anderson as part of their integrated medicine program, as well as acupuncture and, as I said, meditation, nutrition. All these things play into how my attitude and my knowledge has changed me and how I approach the whole person, as opposed to just cancer.
So is there any idea, Miles, about creating a network of coaches that are maybe people from healthcare background that have had problems like yours and have overcome it? Is there a separate network that you think would be beneficial to offer patients of some type?
I actually do, and had that discussion with a friend who is a retired radiologist that was asked the same questions that you and I get asked all the time by patients about who to go to, what to do, because I think in the end, especially as plastic surgeons, we very often become the person that our patients trust and they go to by choice, but they also ask our advice about what they should do when this pops up. So I do think that it's one thing, and Symplast certainly is going to offer us a great platform for communication and this type of communication and support that I think that we definitely need to delve into further and give the patients the resources to continue. And that kind of leads me to another area that I know we've been discussing in terms of post-operative patient care. Has always been something, of course, that just like cancer, we do our surgery and then we have the post-operative appointments scheduled beforehand. But I don't think that we, for not just our patients, but any of our post-operative patients from any specialty, are actually given the opportunity to be monitored closely enough. So an area you and I have certainly had this discussion, we're hopefully in, but I think the technology is getting to the point where we're able to now start to integrate AI into the field, where we're looking to bring in methods of post-operative monitoring for our patients and other patients that anyone who's had surgery, where we'll hopefully be able to add this to Symplast and devices where the patient will go home with remote blood pressure monitoring, cardiac monitoring, breathing, instead spirometry, and be able to enter the readings immediately by Bluetooth and have AI actually be able to determine if a physician group needs to be contacted and the patient needs to be contacted based on these algorithms. And that's certainly something I'm very excited about. I know you and I both talked about, and we had the same thing in our office where we pulled out our drawers and we saw these blood pressure cuffs and pulse oximetry monitors, and basically they were collecting dust. And these are things I think that not just for post-operative plastic surgery patients, but that we can offer to any variety of patients for home monitoring that can be done as many times a day as you wish. And certainly something that we're looking to integrate into our programs. I mean, Symplast, like I said, I'm committed to getting this type of monitoring on there and implemented, because we all fear post-operative untoward events, and certainly if we could do something to minimize the likelihood, or if someone has any signs, then early diagnosis, early notification certainly is going to save people's lives.
Yeah. So just to again summarize, some of the things that we spoke about where technology is going to enable some of these things. So for example, creation of a peer group or a network of healthcare providers, physicians who've gone through and been on the patient side, who can hopefully become this counseling organization that can maybe provide some coaching, like you said, based on the need. Because I mean, I can imagine you as a physician probably were able to research easier and learn easier and interpret things easier, but an average, patient may not be able to do so. So they need something like that. Perhaps maybe organizations exist, but certainly I think, technology can enable and empower people to get connected in that fashion. And Symplast certainly can do that, because we have what we call intercloud connectivity securely and privately. So, you can form a peer group within Symplast user base, for example, that could immediately be spawned and started immediately. You could form, like various, like Facebook groups if you wanted to, but within Symplast ecosystem, where groups of doctors can share, and then perhaps in the future, patients can connect to this group. You can certainly create a marketplace or something where people can get second opinions, as an example. Like they may be in some place, and within the network of Symplast users, they could perhaps reach out through the Symplast patient app and get second opinions of anybody they'd like to do. And I think that may be of value. What you're also talking about clearly is about immediacy of connectivity to physicians, because clearly you are getting your care from Houston, but you live in Atlanta, and there's some need, and you're in Europe, and there was a lot of mobility in everybody's life now, so you have to have access to whatever you need in real time, and so I think with the Symplast cloud ecosystem, I think that certainly is very possible with all the information you need at your fingertips all the time. And I think you also spoke about remote patient monitoring, basically, right? Essentially,
Yes.
because on a Friday, people go home. Something's happening. They don't know how to get a hold of somebody, and they have to go to the ER or urgent care, or they just don't
Yes.
know, and they don't even know if they have a high blood pressure because sometimes they may not even sense it. And so, monitoring all of these parameters, not just blood pressure, but a plethora of different things that we can monitor. For example, post-operative pain scores,
Yes.
or how many times they've walked. Do they have any calf pain, or a whole host of things that you and I can think about? If those are all very closely monitored, that is data in itself that can be visualized by the physician. However, what you're talking about is taken to the next level, where you can now incorporate some of these algorithms that can potentially predict, based on certain patterns of data, that this person is imminently ready for this or that, and intervene before something happens, and you know prevent untoward events, very, very real time, which I think is going to add immense value to patient care. I think those are the broad strokes of what you're talking about in
Yes.
technology.
Again, very, very succinctly put, I think all these ideas are incredible, and certainly not available until we start to integrate all these. And Symplast is really such a great platform to be able to push this information out there, and to engage in this remote monitoring as a preventative, even to carry on with it. And the nice part is with the AI, which everything seems to be going towards the predictive nature of that. At all times, that the time doesn't matter if it's 3 o'clock in the morning. If someone wakes up in distress, certainly to have a lot of the remote monitoring companies are not having people that are sitting up at 3 o'clock in the morning. So all these ideas are next level, but they're here, and we're ready to do them. And that's what's really exciting about the future, because the future's now.
Yeah. So I mean, we're meeting, I think, in about 3 weeks here in Florida. I think your team and the Symplast team is going to get together, and we're going to bring these aspirations into reality, which I think most of it is already there. We just need to make it happen. And so
Absolutely.
exciting times. Anything else you want to discuss, Miles, as our parting thoughts through all of this storytelling that we've done so far?
Well, I appreciate the time, and the experience has been quite obviously life-changing in many respects. As I said, it's caused me to think about a lot of things that I certainly have not taken the time to think about before. And it's actually, in that respect, it's been very good. And again, from my heart to yours, thank you for your support and your friendship, and also allowing us to try and get the technology and users and everything using Symplast as a platform to really be able to enable this. That really makes my heart happy. So I'm looking forward to it. So thank you, Shashi.
Excellent. So Miles, it's been a real pleasure. I appreciate you. I appreciate your journey. I appreciate you having the courage to share it as the way you have, and trying to give something back to everyone. And it's not easy. It's to sit in your seat and do what you're doing, and thank you for that. And thank you, Symplast, for facilitating this. So have a great evening, and we will get back in touch and do another program once we launch the new technology.
I like it. Shashi, take care. I enjoyed it. Thank you for allowing me this opportunity.
Have a good evening. Bye-bye.